and we are all frustrated by the pandemic, but some have been affected more than others. Small business owners, restaurants, retail, it's not easy, and they've all had bills to pay too. But we also know that landlords' frustrations pale in comparison to the worry of an out-of-work mother whose family may lose their home, or a young father wondering if he has to tell his kids that they'll really have to live in their car now. These worries go beyond financial. These worries ask us important questions about who we are and what we're willing to do for each other in our times of need. We must acknowledge the financial and human tolls this pandemic takes on landlords and on tenants. But the data convincingly shows that evictions could trigger more cases of COVID-19 in our community. My director of public health has advised me that allowing evictions during a pandemic is simply bad public health policy. Turning residents out into the street now before they have access to federal funds could keep them in their homes or to vaccinate to protect them. It's just not wise. We can't forget the important strides we've made in our cautious reopening. I worry that an increase in cases linked to evictions could be a big setback in those efforts. So today, I'll be asking the St. Louis County Council to pass an emergency ordinance to stay evictions by fully implementing the CDC's latest eviction moratorium. Thus far in the pandemic, the Circuit Court has stayed all evictions, but in recent days, the court decided to allow some to move forward. We shouldn't let that happen yet. As a county government, we have a role to play here, and I'm asking the County Council to help us stand up for our friends and neighbors facing evictions. Talking with council members over the past few weeks, I know that one of the priorities for the new federal funds coming into the county will be helping people stay in their homes with rental and utility assistance. But our ability to help those people doesn't have to wait on the new federal funds. We can start right now. So I want to thank Congresswoman Cori Bush for her work in refocusing us on all of the challenges our most vulnerable folks in our community face. She has reoriented the conversation here in St. Louis County and increasingly around the country. The people of St. Louis County already have a lot to thank Congresswoman Bush for, starting with the new federal funds that she secured for us. So I'd like to stop here and turn it over to Congresswoman Bush.
Thank you and good morning. Thank you, Dr. Page, for convening these weekly press conferences. It's so vital to our county to have this time with you. And thank you for inviting me to join you this morning. Our teams have been working closely together regarding the looming evictions crisis in St. Louis, and I'm grateful for the opportunity to partner with you to ensure our residents are protected through this public health crisis. This is a crisis happening in our community and across this country, in our world, and we have to make sure that our residents, that our community members, our neighbors are supported. I've been evicted. I've been unhoused. I've been forced to live in my car with my two babies. I know how destabilizing and violent an eviction can be. Being evicted where I didn't even have the money to go to the next place, putting my items, removing them with trash bags. Couldn't even afford the boxes. It can ruin lives and cause irreparable harm in the lives of the children and families who need our help the most. It's a trauma that I would not wish on anyone. We are making significant strides in expanding the availability and accessibility of vaccines, but the Circuit Court's decision to resume evictions would undoubtedly set us back. And we're coming together to emphasize our shared goal of keeping people in their homes. The science is clear. Kicking people out of their homes during this pandemic has led to hundreds of thousands of additional COVID-19 cases. It is deadly and it's dangerous. St. Louis can do better, and we must do better. As public servants, we must do the absolute most that we can to protect the health and the safety of every single resident in this county. I'm proud of the work we've accomplished in Congress. We passed the American Rescue Plan, a historic $1.9 trillion package that included over $700 million for St. Louis local governments and $27.5 billion with a B $27.5 billion nationally for emergency rental assistance to help millions of people stay in their homes. 2 weeks ago, the Centers for Disease Control and Prevention extended the federal moratorium on evictions because the federal government has recognized that displacing people from their homes during a pandemic will only worsen this global health and economic crisis. St. Louis County needs to follow suit, and so I'm thankful for Dr. Page and for the council being willing to make this happen. I want to be clear that the people of our community should not be getting a knock on their door being asked to prove that they qualify to stay in their homes. I urge our community to reach out to our office, reach out to my office, call us if you are at risk of being evicted from your home. Our government must not allow any of us to go without shelter during this public health crisis. I am proud to join Dr. Page today in affirming the basic right of shelter to all St. Louisans, and I'm hopeful that our work together will lead to a moratorium on evictions for as long as our communities must live through this public health emergency. Housing is healthcare. And I'll say that again, housing is healthcare, and it's a fundamental right that should be guaranteed to all, most especially during a time of crisis. And that shouldn't come with what did you do, what do you have, or what don't you have. We're taking care of people today. Your Congresswoman loves you. Thank you.
Thank you, Congresswoman. Before we open it up to questions, I'd like to give you an important update on vaccine appointments in St. Louis County. Beginning Tuesday, you no longer need to pre-register for a vaccine appointment with the Department of Public Health. Now that we are no longer sorting appointments by tier, you can simply log on to stlcorona.com beginning tomorrow and schedule a time you'd like to receive your shot and select which vaccination site run by the Department of Public Health is most convenient for you. And I'd be happy to take any questions.
Dr. Page, we have a few questions today. We are hearing the sentiment, why do I need to get the vaccine if the government is telling me we still need to wear a mask, social distance, and live with occupancy restrictions? What is your message to people wondering this?
So the question is about vaccine hesitancy in the presence of ongoing public health protocols, safety protocols, and restrictions, including mask mandates. We hope that as we get more vaccine acceptance and more vaccinations in our community, we will be able to get away from these public health safety protocols. We expect that we will be able to do that, and hopefully we'll be having those conversations over the next couple of weeks. But we will continue to follow the guidance of Dr. Fauci, of the Pandemic Task Force here in St. Louis region, of our public health officials and our public health experts and our scientists on the best way to keep people safe. We are especially concerned about vulnerable populations. We are especially concerned about getting folks in our community vaccinated. Until we reach those thresholds, we still have to follow the recommendations of our public health experts. We hope that we'll see greater vaccine acceptance in our community as the vaccine becomes more available. We know that vaccination in our community is what allows us to fully reopen safely and allows us to protect the health and welfare of everyone in our community.
And a follow-up, with so many vaccinations now available to everyone, what do you say to those people who are on the fence about either receiving the vaccine or not? And could there be some sort of extra incentive for those who are still on the fence?
So the question is about continued vaccine hesitancy and in our community, and our message for individuals who have not yet scheduled an appointment to get a vaccine. We know, based on advice and information from Dr. Fauci, the Pandemic Task Force, and our health experts, that the vaccine is safe. We would encourage everyone to talk to their doctor about the vaccine, to talk to their friends who've had the vaccine and have done well with it, and to recognize that throughout the history of our country, whenever we've been faced with a new healthcare threat, vaccinations have allowed us to get back to normal, to save lives, to protect our own health, and protect the health of our loved ones. So learn about the vaccine, listen to your doctor, talk to your doctor about it, and please get vaccinated to protect yourself protect your loved ones, protect your coworkers, and your friends and family and neighbors. Congresswoman, would you like to add anything before we close?
Sure. For those who are wondering about the vaccine, as a registered nurse, one thing that I would tell my patients when they had a question about their health is make sure that you're consulting with it's okay, consult with your physician. If you don't have a physician, look, there are people that are at these vaccination sites that you can talk to. If you feel like, I'm not sure if I should take this vaccine, go and talk with those people. We have experts that are available. You can call our office if you want more information. What we're trying to do is to make sure that we save lives. Our job is to save lives out here. And so we have done the work to try to make sure that the vaccines are available. Now, you don't even have to have an appointment. There are places that you can go in our community where we ask that you register. We encourage that you register, but if you cannot, you can still show up and walk in to have your vaccination. At this point, anyone in Missouri that is over the age of 16 can show up to, especially at the Dome, but in other places, you have to be at least 16 years old to receive your vaccination. Especially when we're talking about our Black community members and Brown community members, we are disproportionately suffering from this pandemic, suffering from the cases of being infected, and then also suffering the most deaths. So what we're asking is that you receive this vaccination to make sure we're keeping our families, like Dr. Page said, our communities, keep yourself safe, and let's get through this pandemic together.
Thank you, and thank you for joining us here today.
Thank you.